there. I'm just finishing getting everything set out here. Sorry for waking you. I'm Dr. Sarah. Okay. Let me just pop some gloves on. Sorry it's taken me a while to get to you, my lovely. Been a really busy day with the surgery. But I'm here now, so I'll take a look at you. Your friend let me in. Okay, so I've just got my notepad here. Okay, so you've been experiencing a very, very sore throat, painful ears, temperature, yeah? Okay, not been feeling well for about 4 days. Oh dear, you don't look too good, to be honest. Right, okay. Has anybody else that you know of got similar symptoms? Okay. All right. Okay, so have you just been resting for a few days? Okay. Okay. Right. Okay. So let me just take a little feel of your lymph nodes, my lovely, just down your neck, okay? Okay, looking a little bit swollen, feeling a little bit swollen. Was that tender? Okay, all right. So let me just get my thermometer, my lovely, and I'll take your temperature, okay? All right, I'll pop it into your ear. All right, I'll be very, very gentle because I know that your ears are feeling sore, aren't they? All right. Okay. Here we go. Just a couple of beeps. Put that in there now. Okay. Right. So you do have a little bit of a fever there, okay. Just make a note of that. It's at 38. Ideally we wouldn't really want it any more than about 37.4. People do vary, but that's definitely a fever, okay. Have you got the body aches? They keep coming and going. Okay, alright. So what I'm going to do is just get a tongue depressor, my lovely, and I'm going to take a look down your throat. Okay, just got to find my little light. To carry everything in my bag, obviously, when I'm doing home visits, so I have to have a little look around things. Okay. Now, this isn't going to be particularly pleasant for you, I know, if you've got a very sore throat, but I just need to take a look, okay? So could you open nice and wide for me? Perfect. I'll put that in there. Okay. Alright. Okay. Just relax there. So, you've got some spots over your tonsils, okay? So, have you had problems with your tonsils before? Tonsillitis? Okay, right. Okay. going to take a little listen to your chest. Have you been coughing at all? Okay. Alright. So, just want you to take some nice deep breaths when I tell you to, my lovely, okay? I'm just going to put the stethoscope onto your chest, alright, here we go. Okay. And in and out, okay. Lovely. Just going to move that there. Okay, and there. There. Okay. Nice deep breath again here. Okay. Alright, lovely. Could you give me a cough, please? Just pop that up higher up your chest. Okay. I'm just going to place it onto your neck now. Just breathe normally, okay? There we go. Okay. Alright, just relax there, my lovely. A little bit of wheeze in your chest, but it's not so bad. But I'll mark that down. Okay. So while I've got my stethoscope, I'm going to check your blood pressure, alright? Okay. So let's get the cuff. Just going to pop this around your arm here, alright? There we go. Okay, just pop the stethoscope on there. And I'll inflate the cuff. It will feel tight for a little while, but I'll be as quick as possible, okay? Alright, there we go. Alright. Okay. That's fine. Okay, just pop that down there. Okay. Have you been experiencing any tummy pain at all? A little bit, okay. I'll have a little listen with my stethoscope, alright? Okay, just breathe normally for me. Okay. Okay, that's fine. Your bowel sounds completely normal there. The sounds are just very, very average sounds, so that I'm happy with that, okay? Yeah, I'll have a little press around though. Yeah, okay. Sometimes with infections like particularly tonsillitis, which this might be, you can get like some tummy pain and some lymph node involvement, which can make you feel rather sore all over. Okay, so I'm just going to do some gentle pressing around. Okay, alright, so tell me if anything's painful, okay? Okay, a little bit deeper now. Everything seems fine there. Now you've got some lymph nodes across your shoulder area, so I'm just going to have a little feel of those, okay? Right, here we go. Okay. They feel alright. How are your eyes feeling? Just a bit achy, okay. Headache? Right. Just a little look in your eyes, okay, my lovely. Just look straight there for me. I'll be very, very quick with this, okay. Quickly bring that in there. Quickly bring that in there, okay. Okay, that's lovely. Okay. So I'm going to have a little press just around your sinus area. Tell me if it's tender anywhere, won't you? Okay? Right, here we go. Okay. So just gentle presses. Sore? Okay, up here. Okay, what about this side up there? Okay, a little bit lower down. Alright. Yeah, probably got a little bit of congestion up there, haven't you? So we'll make a little bit of a note of that. Okay. Okay. That's fine. Right. So I'll need to take a little look down your ears because you have been saying that they're sore. Yeah, I'll be very, very gentle. Please just pop up your hand if anything is painful. Please don't move. I don't want to hurt you. Okay? Perfect. Right, let me just find my otoscope there. Okay. Nice new tip on there. Perfect. Okay. So I'm sure you've seen one of these before, but it has a little light, and that light just shows me what's down your ears, okay, after I gently insert it. Yeah? Okay, I'll start with your left ear, okay? Okay, my lovely, so I'm just going to insert the otoscope now, okay? There we go. Lovely. Let me just have a look. Okay, well, I can see that there's some redness down there. Fluid build up behind, a little bit there, behind the eardrum. I'm guessing this is all coming from your throat. Okay. Alright. Not too much wax, that's a really healthy amount, so that's perfect. Okay, I'll withdraw that. Okay. Doing alright? Same again on this side, my lovely. Just going to pop it in very gently. Again. Right. Again, normal amount of earwax, slightly red ear canal, a little bit of fluid from an infection behind the eardrum. But the eardrum is not perforated in any way, so that's good. Sure, that's just from the infection in the throat area. Right, let me just withdraw that now. Okay. Right. While I'm here, I can just take a little look up your nose. Alright. Just going to push up a little bit. Okay, here we go. A little bit inflamed up there, aren't we? Let's check this side. Okay. Yeah, okay. you just relax there. Okay. Won't be needing that again. Right, so I'm just going to pop this on your finger. I'll just check your oxygen sats. There we go. Doesn't take long. Just like to give you a thorough check out while I'm here. Okay, thanks, lovely. Alright, oxygen sats are good, they're at 98, that's perfectly fine. Your pulse is healthy too. Okay, so that's good, let's write that down. Okay, perfect. Right. So in terms of medication, have you been taking anything? Okay, so just paracetamol really. Okay. Can you take ibuprofen? Okay, they upset you. Alright, that's fine. They do for many people. Yeah. Yeah. Okay, well, you're going to need antibiotics. You're not allergic to penicillin, are you? Okay, alright, so I'm going to prescribe you a penicillin. To me, it looks like you have tonsillitis. Yeah. You've got very inflamed tonsils and they're very spotty as well. And with all your other symptoms and the fever, it certainly ties in. Yeah. Yeah, if you repeatedly have this happening, we can look at taking the tonsils out. We try not to, but when you've had repeated attacks of tonsillitis, we can get them surgically removed. Years ago, they used to be taken out all the time. I had mine removed with my adenoids when I was 6 years old, but lots of children had tonsils taken out then, but we try not to do it now. Children or adults unless we have to. Yeah, but don't worry, I'm hoping we can get this infection down. Yeah, okay. Well, what I'm going to do for you is I'm going to give you an injection, alright, of some paracetamol. Save you having to swallow the tablets. I can do that for you, yeah. You haven't taken any for hours, that's fine then, that's okay. I'll give you that little injection. It's very quick and you feel a very sharp scratch, very tiny scratch, alright. Okay, I'll also put some drops down your ears. I'll get a prescription sent to the pharmacy for the penicillin and some of the ear drops, which will just help my ears feel a little bit more comfortable. You happy with that? Okay, right then. So let me just get this all together. Excuse me, rummaging around in my bag. Okay, so this is the paracetamol. I need to just draw up. Okay, that's perfect. Okay, let's find that syringe in there. Just get some of this drawn up. No, you don't need a lot. Not a lot at all. There we go. Okay, that's fine. Just going to give your arm a wipe. Do you have any preference on which arm? This one? Okay. So I have a special wipe here. I'm just going to prep your arm with that, okay? There. Right, sharp scratch, okay, one of me. There we go. All done. That wasn't so bad, was it? Okay. Right, so I just need to make a note of what I've just given you there. I have to get all this typed up when I get back. Okay, so that's just equivalent to 1,000 milligrams. Okay, so you won't need to take any more paracetamol for 4 hours. 4 to 6 hours, the longer you can leave it the better. Okay, if you're having problems swallowing still, we can get you a liquid formula of that. Yeah, in fact, shall I just prescribe it anyway? Yeah, I will. I'll do that anyway. Right. Okay, so I'm going to make a note of that. So I've got the oxymethylpenicillin and the paracetamol suspension. Okay, and the drops there. Right. Okay. So I'm going to put some special drops in your ears, as promised. I want you to try and feel as comfortable as possible. Are you drinking plenty of fluids? Good, that's perfect. That's what we like to hear. Right then, found those. I always bring some medicines out that I think might be appropriate for each patient when I get a home visit. Just have to give these a bit of a mix. You like that sound? Yeah. It's nice. Okay, my lovely. I'll start with this side. Right. Okay. Here we go. Here's 1 and 2. Perfect. Okay, do they feel good? Wonderful. Here we go. Here's 1 and 2. Wonderful. All good? Perfect. A little wipe for you around here. Right, so I'm going to tidy up the mess that I've made. Okay, it's all going in the bin. That's perfect. Just empty that there. Put that in there. Okay. It's a tight squeeze in this bag. Should have bought the bigger one. That's everything. Okay then, my lovely, well, I'll leave you to rest and I'll just take my PPE off and then I'll be away. Your friend will let me out and they'll be able to go to the pharmacy and get that medication for you. Yeah. If you don't feel any better after 5 to 7 days, please let us know. If you start to feel worse once you've started the medication, please call us or go to A&E. Okay, but drink plenty of fluids, even if you don't feel like eating, just plenty of fluids and some nice liquid foods, nice soups. Yeah, because trying to swallow food I know is very, very difficult when you're so uncomfortable and inflamed. Yeah. You could also gargle with salt water as well. That's quite healing if you can tolerate that. Okay then, my lovely. Alright, well you can close your eyes and have a rest, and I'll just pack up the rest of my things and I'll be off, okay?